Hi, this is Dr. Roy Kim. I wanted to talk about an interesting article in PRS Journal on Asian facelift and using composite or deep plane techniques in Asian faces. So what's interesting, of course, is that the techniques as a plastic surgeon are actually the same or similar in all ethnicities and including men and women. There are some subtleties in terms of ethnic differences regarding Asian patients versus other ethnicities, and this article does address it. So first of all, what's a deep plane? So as I've discussed in other videos, deep plane really means we're not necessarily going deeper compared to regular facelift, rather we're going deeper in certain areas. So the thinking is if we go deeper in certain areas, or more medial, actually more medial this way, closer to the nose, we can actually get a little more pull and we can actually help rejuvenate the structures that are more in the middle of your face, specifically nasolabial fold. We can really do a great job at the jowl. But in terms of actually being deeper, in terms of closer to the bone, that's actually not the case. We're still under the same structure, the SMAS, superficial muscular aponeurotic system, but we are going deeper, maybe medially, not necessarily deeper towards the bone, away from the camera lens, but rather deeper in terms of more towards the middle of your face. Asian faces definitely differ from other ethnicities. Asians tend to have flatter cheekbones, a wider face, and also different fat distribution areas. Typically, you want to rejuvenate the cheek because, as we all know, baby fat right here flattens and drops, and that's a sign of aging. So we want to sort of enhance the cheek fat that you have. So there are a couple ways to do this. Of course, we can always use your own fat that's existing in your face and cheek and reposition it. The other thing we can do is actually, if you have a very round face, a very chubby face, we can do a buccal fat pad excision right here, remove some of the cheek fat, and since we have a facelift incision, it's more straightforward, it's a lot more open, better visualization to actually remove the buccal fat. In terms of buccal fat pad, essentially you need to be having a really round face to get the best aesthetic result. I generally would not do that in a patient who already has a very contoured cheekbone or jawline because as you get older, it may actually be a little too hollow. A lot of Asian patients do not have this as a main aesthetic concern. So in other words, it is safer aesthetically to remove the buccal fat. I can always just reposition your skin. Nobody really does that because even though it looks good, it doesn't last that long. I want to reposition the SMAS, the deeper structure, the superficial muscular aponeurotic system underneath your skin because not only does that look more natural, it's actually much longer lasting. The authors discuss about closing the SMAS in 3 layers, which is fantastic, so they don't need drains. And this is one of the other hallmarks of doing it with a deep plane or composite facelift. Drain is optional. A drain sometimes is necessary in the patients. However, if we can actually close it up very nicely and tightly without giving it an overdone look, then yes, you will not have a drain when you leave the operating room table. Of course, with this technique, the patients did great, and the authors did look at long-term results and found that the patients did well in terms of their long-term appearance, but also in terms of bleeding, bruising, swelling afterwards, they did fine as well. So this is also important, where if you're doing a facelift and you're modifying the technique a little, obviously we want to make sure that the patients do well post-surgery. And the authors did show this. In terms of the composite Asian facelift, this is a slight tweak on existing facelift techniques and technology. And as always, each patient is different. The anatomy is always the same, but everyone is an individual. So it's important to get the treatment plan that is best for you, not only your goals and not only your ethnicity, but really what's holistically best for you and your individual face. If you have any questions about this or comments, please let me know. If you have any future topics you want me to discuss, let me know. And of course, there are other YouTube videos that you can check out on my channel right here. Thanks so much for watching.